participate in educational process. The first step in educational process, you need to know this depending on the adult theory of learning. Adult theory of learning is to depend on you. Nobody will give lecture. Today, I'm not going to give any lecture. I'm going to practice some self-directed learning. Will show you some images. From images, you need to make a diagnosis. For further information, you need to go and I will not tell you what is this. If it is Down syndrome, I will not tell you how you will do counseling or what are the cardiac complications. No, this is not a way for teaching people at this stage. Are adult learners. So you need to learn by self-directed learning. For you to pass any exam, you need to consult many previous exams. You need to be opportunistic. You need to share in the grand round of the hospital. And you need to make your common sense whether I need to go further in depth in this case or not. And somebody who's seen many cases of Down syndrome is a knowledgeable and will be skillful than a person who only saw one or two cases. So repetition of the cases also will make a very strong background for you and will help you for future practice. Again, you are in a process of self-directed learning. Wait for somebody to give you a lecture. I'm not a teacher. And tomorrow, when you graduate, you will not be a teacher. You are a facilitator, and you will be a facilitator, just to facilitate the knowledge for others. Don't depend on teacher. Depend on you, on your process. If I am a consultant with you, and you have emergency duty, I will sit just only for consultation. I will not go to do palpation, application for you. You are the one who need to do this. But if you have confusion, or you have a difficulty, Prof, come and tell us, what is this? You are in doubt. What is the diagnosis? Or if there is any controversies, I need to help. So please, again, it is yourself who will do your own work. It is yourself who will go and pass through previous exam. Exam at the level of this board, at the level of Arab board, at the level of MRTB. You need to have a big vocabulary. So please, this is the main philosophy. This, they call it OSPE. OSPE, also, if you have any image or picture, please focus on the center of the picture. Concentrate what is the question. The most possible question in OSPE, they will tell you spot diagnosis. Sometimes they will tell you what is the diagnosis. What's the most common complication. And only it is very few words needed. It's not an S. So we're going to start again. Please keep this here. It is a hands-on. Start from here, and then we'll go around, and everybody will tell us his impression. If you know the answer, it is good for you. Might not be so good for me. If you don't know the answer, it is good for me, and it is good for the others, and it is very good for you. Because if you don't know the answer, you go home, you will go and read. Okay. So again, as I mentioned, Dr. Ahmed Abdelhadi, Dr. Karim, and this is Dr. Widad. We are going to alternate presentation together. So let's start from here. The spot diagnosis. Okay. So I need to move somewhere. Yeah. What is this? Next, so of course, we'll go and read. We will not go and get. Yes. That right. This cover or long or something wrong. So this is the most common for question. Right. Hello there. Hello. Is the voice clear now?
دكتور كريم الصوت بتاعك هسي كده احسن واحد. الحته اللي هسي انت قاعد فيها ما تتحرك، بس خليك في نفس المحل.
Okay. Okay.
ايوه
Okay.
تمام. طيب you
So
can go
if
من picture 1.
we can go back.
ايوه من الفيرست بيكتشر الصوت كان ما ايوه كده الصوت واضح.
So
you can go.
this picture 1 answered as kefal hematoma, and second picture was answered as earth palsy and absent motor reflex, and third one they mentioned the facial palsy, and most probably it is low motor neuron.
Okay, very good.
Okay.
Yes, continue please.
Don't worry, don't feel shy. It is learning. We are learning from each other. Myself, I revised it yesterday. Otherwise, I forget it also. So what is this? Don't worry. We have more than 120 pictures. If you don't answer, it is not shameful. Yes, doctor.
Some people في الشات بوكس عندنا هنا كاتبين stage فيبر. Some of them they are saying Portwine.
Excellent, excellent. In the chat, yes, please, Dr. Ahmed, also remind us with the people who are sharing the link, because we need to know their reaction. So they said that, and wherever there is interaction from there, you can tell us also. So it is Portwine and stage Weber syndrome. Some people they mention stage Weber, other stage Weber syndrome, and other stage Weber syndrome. Yes. Yes, where we are here. Yes. You need to know this. If you close your eyes in our setup, we need to remember and to define this. It is OSCE child. If you say failure to thrive, if you say malnutrition, I will never. All are accepted.
Some people they are saying Dr. Isra, and others they are saying celiac.
Possible celiac will be wasted also, and it seems that sure all are accepted. Examiner is not interested. Examiner is not interested to keep you. Examiner always are logic and waited for your response. And as please, Dr. Mohamed, keep contact. I like this interaction from your side on behalf of those who are sharing the link.
Some of them they are saying malnutrition.
Accepted. Accepted answer. Sure. Huh? What is this? Meningococcemia, it is not good. How do you know meningococcemia?
Some of them they are saying chickenpox. Some of them they are saying Steven Johnson. And some of them they are saying Steven Johnson again.
Okay. If you are examiner and you brought this picture, in exam, do not give it like this. He will give you a clue. What is a possible clue for this picture? Yes, any medication like such as
Some of them they are saying epidermolysis bullosa. Some of them they are saying toxic shock syndrome toxin. Some of them they are saying this is related to carbamazepine.
Carbamazepine possible. health and has
Some of them they are saying sulfur containing drugs lamotrigine.
the best answer sulfur containing.
Some of them muffin right.
Huh? Exactly. We'll not stop more on this. Yes?
معلش دكتور كريم picture number 7 the answer was not clear for picture number 7.
يلا دكتورة mission's answer. Fallacy. Yeah.
Okay, on fallacy. Okay.
Yeah. Yes. Uh-huh. Dora? Uh-huh. Yes. Don't focus on one area. So this is a sort of cheating because there's a mark there. Don't imagine he means that. He means the whole thing.
They are saying nephrotic syndrome.
Exactly. Generalize what is swelling. Even the abdomen. Don't concentrate on the area of penis or perineum because there is a mark.
Yes.
Even.
Anasarca. Yes.
So don't be missed also. Aha. This man unit was born with multiple fractures and deformities. One bound.
They are saying osteogenesis imperfecta يا دكتور كريم. Osteogenesis imperfecta.
Aha. Aha. شفتوا those people using the link immediately they react. So on competition between those who attempt here and those who are nowadays as a medical educator.
Some of them they are saying arthrogryposis.
This is the best answer actually. It is the best answer. Yeah. Developmental age of this guy. Here this might be controversial. What is the developmental age of this guy? What he's doing? Here. Sorry, here. Yes, here.
They are answering 10 months, yeah, Dr. Karim.
10 months, we agree with them. We agree with them. So now,
Okay. طيب. They are saying diaphragmatic hernia, congenital diaphragmatic hernia.
Will answer.
Doctor, they are answering myasthenia gravis في chat. They are saying myasthenia gravis, they are saying ptosis.
The answer. Myasthenia gravis.
Okay.
Will answer. Spina bifida. Another answer. Meningocele.
Yes, they are saying spina bifida meningocele.
Meningocele or
myelomeningocele.
Meningocele.
يا شباب في الاونلاين زوم بليز تراي انكم تكتبوا في الشات لانه الشات is more faster than a question and answer. اكتبوا في الشات كلكم.
Open. You want to answer in the chat? You can prepare yourself now to answer in the chat.
ايوه
اونلاين.
ايوه في الاونلاين يا دكتوره. ايوه في الاونلاين. الناس اللي عندي في الزوم هنا عندي حوالي 129 they are answering. طيب فهم حيكتبوا في الشات and I will relate you. Still نحن في picture رقم 30.
طيب hydrocephalus. Deformed ear.
They are saying hydrocephalus.
Okay, accepted. How to examine, how to diagnose.
The previous picture يا دكتورة في some people they are saying P-Robin sequence.
Sorry, Dr. Mohamed.
The previous picture 14, some people they are saying this is can be P-Robin sequence.
Because micrognasia.
But the correct answer is hydrocephalus, right?
Yes, sir.
They just want the simple answer, hydrocephalus.
For the next picture, they are saying transillumination test, positive transillumination test.
You have to know how to do this test. Hey, what is this? Will answer.
Some of them they are saying, Dr. Widad, they are saying hydrops fetalis.
Okay.
Some of them they are saying this ostosis. Some of them they are saying achondroplasia. Also they are saying osteogenesis imperfecta. Some of them they are saying osteogenesis imperfecta.
Yes.
والله أنا to me it is most يعني hydrops fetalis possible, achondroplasia possible. So also now, as you mentioned, self-directed learning, you will go and check this picture. What is it? And you will not get the answer from me only.
Some of them they are saying skeletal dysplasia, Dr. Karim. Some of them they are saying rhizomelic shortening.
Okay, we'll come back to this slide later.
What is the sex ratio? What signs you are praying?
Some people they are saying cupping. Some people they are saying this is rickets. They are saying cupping, rickets. Look يا شباب, look again. Look a clear white line. What is the clear white line? They are saying rickets يا دكتورة, large space. We have Abdelhadi saying lead poisoning. They are saying lead poisoning. Some answers is lead poisoning from Dr. Taqwa.
This is rickets, most likely.
Okay, rickets. Okay.
Unencephalitis.
Yes, unencephalitis.
Dr. Mohamed.
Aywa, yes.
The last slide show unencephalitis.
Tamam, unencephalitis, yes. Okay.
19.
I have Epstein anomaly.
Yes. Stein anomaly. Yes.
Epstein anomaly. Okay.
Yes.
They are saying squintia, Doctora. Some people they are saying this is Cornelia de Lange syndrome. Cornelia de Lange syndrome.
لا.
دكتورة وداد صوتكم ما واضح. What is the answer? معلش الصوت بعيد شوية. For picture 20. Cleft lip and palate. Cleft lip unilateral.
طيب هنا في answer left lip
Yes, we have cleft lip.
unilateral.
Unilateral.
Only cleft lip. Cleft palate is not clear in this picture.
معلش دكتورة وداد الانسر for picture 20 كان شنو؟
Just a minute. Okay.
دكتور كريم صوتك بعيد.
قاعد شاقبين.
ايوه كده صوتك كويس. ايوه خليك في البوزيشن ده دكتور كريم كده الصوت كويس.
We'll come to 20 later on.
تمام.
What is this? What is this? Hemangioma possible. Any different answer, Mohamed?
We have hemangioma here. We have Bortwine stain.
All of them are right.
Hemangioma.
Okay. What is this? Cushingoid face. What is the cause?
Cushingoid. Cushing.
Okay. 24. What is this? Pseudo? Yes, I agree. Dr. Ahmed, what is that?
ما عندي answer يا دكتور ما كتبوا.
Pseudo hypoparathyroidism.
اوكي. سودو هايبوبارا يا شباب مو الدوستيرون. سودو هايبوبارا. It is not a hypoaldosteronism. It is pseudo hypoparathyroidism. طيب.
25.
I have 25. I have goiter.
What is 25 يا جماعة؟ والله this 25
exophthalmos. They are saying exophthalmos. Some people they are saying hyperthyroid.
Yeah. What is the opinion here? This room.
Facial pulses they are saying.
The answer here?
Horner syndrome.
If you say hyperparathyroidism is true, there is exophthalmos. Yeah, there is lid lag. But if you look carefully on the left side, you can say also, yeah, facial pulse might be. But the ideal answer was hyperparathyroidism, in fact. Yeah, hyperthyroidism. You are right. So I will reassure you, such picture will not appear. Any picture at convention. Yeah. But I need to tell you, the examiner, they do their best to be fair. So such question will not come. I gave it as an example for you. What is this? What is this? And the next slide. This and the next slide.
Some people here, they are answering chelosis.
It is scabies. It is scabies. In fact. It is
It's
scabies.
scabies. It's scabies,
Yeah.
yes.
Both scabies, huh? Yes. Nodosum. What is the answer there, Mohamed?
Erythema nodosum.
Exactly. We'll go very fast. Also, they will give you a scenario. This child received some type of-
I have Steven Johnson syndrome.
Exactly. Infantile eczema. Good. I will go very
They are
fast.
saying.
120. Huh? Illusion link
They are
there.
saying Hennigschuh line purpura.
Exactly. And this, the same thing. Now, Dr. Widad will continue. I like it here. Yes.
We have blueberry muffin rash. Blueberry muffin rash. We have meningococcal septicemia. Some people, they are saying toxic shock syndrome toxin. Meningococcal septicemia. دكتورة ما عرفنا الإجابة بتاعت ال 33. الإجابة شنو؟ صوتكم بعيد. صوتكم بعيد يا دكتورة.
دكتور محمد
أيوه تمام. صوتكم الإجابة حق 33 شنو يا دكتورة؟ meningococemia. Okay. Arthritis with effusion. meningococemia يا شباب. ال 33 الإجابة meningococemia. Effusion, joint effusion. They are answering arthritis. الإجابة هنا شنو يا دكتورة في 34؟ الصوت بعيد يا دكتورة، صوتكم بعيد. أيوة يا دكتورة أيوة. Juvenile arthritis. Okay, clear. They are saying tetralogy of fallot boot shape heart.
Yes.
Okay.
Bilateral inguinal hernia. Answer, Dr. Mohammed.
Okay. Bilateral inguinal hernia يا شباب. It is not a hydrocele. It is a hernia. معاه hip dislocation.
احنا مشينا فاصل.
دكتور كريم نحن وصلنا لحد الهيرنيا وبعد ذاك you move.
Yeah, I understand. You have some very small problem. We are going to correct it. Don't worry.
Okay.
Who will help us to make it big? Come. Who will help us? Just to make it big, to unify it. Where in Hello, Mohamed. Mohamed.
Yes.
Thank you very much. Okay, Mohamed, you are there?
Yes, we are
Mohammed.
there. Yes, they are saying this is the trolley of valute boot shape heart.
True. It's true.
Yes. They are saying this is bilateral inguinal hernia
Yes, true.
with hip dislocation.
Just bilateral inquiry.
Okay.
Yes.
They are saying TAR syndrome. TAR.
Yes. Absent.
Okay, TAR. Absent radius. Okay, TAR syndrome.
Those what? This side?
يلا يا شباب. Jobert, we have Jobert syndrome. Molar tooth appearance.
True.
Okay. What is the X-ray finding?
So what is the diagnosis? What is the treatment of choice?
Pneumomediastinum. Pneumopericardium.
Yeah, we have a doctor according to the size. Okay.
What is the diagnosis, ya doctora?
Pneumopericardium.
Okay.
Dilated ventricles.
Mohammed, you are with us?
Yes, I'm with. Yes, we are following.
Dilated hydrocephalus.
They are saying hydrocephalus. Hydrocephalus.
It's dilated ventricle.
Dilated ventricle.
The question might not be what is diagnosed. The question might be describe this finding. Yeah.
Okay.
And then what is the possible cause?
A treatment depending on the size of the pneumopericardium, ya doctor.
Okay, yes.
Okay, 41. يلا يا شباب 41. Left side pneumothorax.
ما في أحد جاوب هنا.
لا يا جماعة نحن want to hear you.
They are saying pleural effusion. They are saying right tension pneumothorax. Tension pneumothorax.
Yeah, you need to say something. Yeah, Dr. Ahmed.
Aye.
I suggest before you mentioning the answer, to give the chance also to those people here to say something. Then after 20 seconds, if they don't mention the answer, you can tell us the answer over line. You need to say something.
Okay, and I will wait for your 20 seconds. Okay.
Okay.
Where is 20? This part of the answer, you will get it here. Provide you some answer here. Mohammed, you are with us?
Yes, we are following.
So this have seen previous, and they say
the side. Fallacy.
Encephaloceal. I have encephaloceal also.
Port wine.
what do you have there?
I have Bortwine.
Yes.
Okay.
Okay.
So this is very few
Very
information.
universal.
The product is formed with the triad. Has a triad. You need to know what is this triad. The exam might ask, did you this picture and ask you what are the triadic syndrome? What is this? No? What is this? But if you think you are right. But the question might be describe this finding. Mohamed, what do you have there?
We have retinal.
Mohamed.
Yes, Dr. Karim. We have retinal hemorrhage. We have papilledema.
You need to describe dilated vein, hemorrhage, all these things.
Color.
Color in the center. He might ask you what are the findings.
Yes. So what is the answer regarding this one, Dr. Karim?
We mentioned could be papilledema, could be hemorrhage. But the best question is describe this finding with this hemorrhage and central color.
Okay.
Question is describe the image.
Dr. Ahmed,
Yes.
you look, the question here is not what is the diagnosis, describe the image, the finding.
Okay.
What is the sign here and give example?
Your voice. Huh? Leuco. Examples.
What do you have there, Mohamed?
I have leukocoria. I have absent red reflex. I have retinoblastoma.
It's okay.
Both are right and accepted. And the example could be code disease, could be congenital cataract, could be ocular toxocariasis, could be retinoblastoma. All
Yes,
people
I
they
have
know.
that. Yes.
Check with them. So no question to them. Describe this finding. Describe this finding. What are these?
Fine. Retinal hemorrhage.
Mohammed, what's there?
Dr. Karim, we have lost your voice. We have lost your voice here, Dr. Karim.
Hello there.
Yes, we have lost your voice. Can you hear us?
I hear you very clearly.
Yes, okay, we can hear you. So I have here for this one, I have retinal hemorrhage, I have retinitis pigmentosa, I have cherry spot.
The best answer is yes.
What is your answer? Retinal hemorrhage.
Hemorrhage.
Okay, we move to the next. Cherry red spot. I have cherry red spot.
Accepted.
Where
Where we get it?
we get it? But how did I
So exactly. Tay-Sachs syndrome and all this. Huh?
National.
Shabab, read the question, huh? Read the question. It is about what maneuver? you can do to support your suspicion. It is not about the diagnosis.
Okay.
Dr. Karim?
What is there? What is there, Mohamed?
They are saying it is a waiter tip position. They are saying to do. Some of them they are saying more reflex. Some of them they are saying nerve conduction study.
Right. Yalla, here I want to say something. I want to say something very clear. Question: what is the manual? He didn't tell you describe this finding. He didn't tell you, ask you what is the diagnosis. So read the question carefully. What is the manual? If you say waiter tip, or if you say anything, it might not be the best answer because he tell what is the manual. The manual is more reflex. You hear me, Mohamed?
Yes, we
Mohamed,
can hear you. We can hear you clear, Dr. Karim. تمام. يلا يا شباب, yesterday قعدتوا لحد الساعة 12 for the hematology. You should know this one. يلا. Okay. Ring stage. I have ring stage malaria. Yes.
Yes.
I will never say anything about it. I will never say anything. What is this thing?
In and out about malaria.
What? look here's a trick. He didn't ask you what is the finding.
What is standard treatment?
What is the standard treatment? He can ask you. He can ask you what is the complication. He can ask you what is the organism. He will never ask you what is it. Even the mother at home, they know what is it.
They are asking about the treatment يا شباب. الناس اللي في الchat. They are asking about the treatment. You need to read the question.
Yes. So this is one of the, today one of the art of how to pass the exam. Look at the center of the picture and look at the question.
You look one here and one there, and you fail.
You fail. So don't,
Stick on every question and أكد إنه.
If I'm a file examiner, I will give you what is this. But sometimes I need to be more kind so that to help you to think. Okay, Ahmed?
Dr. Karim, صوتك بعيد شوية, لكن I have answers here about benzazine, penicillin.
So what is the portfolio in Sudan?
Okay.
Okay, good answer. Good answer. For that, I will continue. You can sit now. You can sit and I will recruit people from the back to answer.
Dr. Karim, they are asking about the answer of the previous question.
Hello, Dr. Mohammed, you hear me? Hello?
Yeah, صوتكم بعيد يا دكتورة وداد.
Hello? Hello?
Yes, دكتورة وداد, صوتكم بعيد شوية.
Where is the problem? Hello?
أيوة.
محمد.
كده كويس يا دكتور محمد.
أيوة يا دكتور كريم.
طيب ما سامع وداد في قاعدين في نفس المحل.
لا دكتورة وداد صوته ضعيف شوية.
دكتور محمد.
أيوة تمام كده سامعين. Okay, I have VUR grade 5, VUR grade 4. Some are answering dilated bilateral ureters. Some are saying BUV. تمام. This is MCUG يا شباب. It is not a hydronephrosis. This is MCUG with VUR. Yes, this is MCUG with VUR. Well, findings. Yes.
Mohamed, as a nephrologist, I will give you 1 minute to talk about this.
You mean the previous slide? Yes. This is an example of an MCUG with abnormal bladder, trabeculated bladder, dilated. You can see the tortuous ureters up to the pelvic-calyceal system. Almost there is no anatomical calyceal system which is seen normally. This is VUR grade 5, severe form. So we are losing the kidney due to the high pressure from lower down. Okay, we can move to the next Dr. Karim.
Diagnosis. SLE with malaria. Dr. Mohamed.
Yes, I have in SLE, Malal rash. Yes, they are saying SLE. Lupus rash.
Might be what are the criteria needed for diagnosing this condition? This might be the question. Everybody know what is a butterfly rash. Anybody know it. But the question might be what are the criteria? What are the WHO? What are the recent criteria? The question might be in that pattern. Ahmed. Ahmed.
Yes, Dr. Karim.
Yalla, Dr. Widad is you.
I have answers here. Sickle RBCs, sickle cell anemia,
Yes.
sickle cell disease, sickle cell. Some are saying iron deficiency anemia, sickle shape RBCs. صوتكم بعيد. ايوه الصوت بعيد يا دكتوره، ما سمعنا اجابتكم في البريفيوس سلايد.
All are accepted يا دكتور محمد. Sickle cells.
Okay, good. Yes, I have target cells. Some people they are saying this is spherocytes. Spherocytosis, blast cells.
Hypochromia.
ما عندي hypochromia. Stomatocytosis.
For this question, yeah, Dr. Ahmed, concentrate. This arrow is point to this one. This arrow is point to central color. They are not point to this one look like plastic. No, they point. So this is why you need to be careful. The examiner, when he gives arrow, he wants you to concentrate on these three cells. Yeah, so it is hypochronic. Okay, Mohamed?
Okay,
Mohamed.
Dr. Yes, I'm following. I'm with you, Dr. Karim. Okay.
Also, my big reply, I think it's really one. Before we go from there, I will start. What is the time?
Dora.
Yes, I have infantile spasm. Dr. Widad, I have infantile spasm. Can you hear us?
The ideal answer is tonic spasm. Dr. Ahmed,
Yes.
tonic spasm.
Okay. يلا يا شباب, what is this one? Yes. Yes. Dr. Karim? Dr. Widad? It is Ashley. Ashley, yes. Yes, hypopigmented macule, Ashley. Yes.
Okay. So the question here, everybody can know identify the partner. Try to define it. And see that finding it. And I let it
Yes, I have hydrocephalus here.
Describe other features, other signs.
those people who are sharing you online, the question might be describe the finding, not give the diagnosis. You hear, Mohamed? Mohamed,
Okay, yes, clear, yes,
Tell-
clear.
tell them that the question might not be what is the best diagnosis, might be describe the finding, like sensitive eye, shiny
Yes.
forehead, dilated.
Yes.
The question might be like this,
Okay.
okay? And might be the question, what is the most complication of the treatment for this condition? So the question might be like that, nephritis shunt.
Yes.
Mohammed,
أيوة دكتور
Mohammed,
كريم. أيوة.
I think the voice will come later, I think. But
I
answer might not be Mongolian spot. Might be the answer, what is the most common type of this condition? How many, what are the Dominic? A common type.
Dr. Karim, your voice is very far. They didn't hear you in the last comments.
Can you go, Mohamed?
In the previous, yeah, Dr. Karim, they couldn't hear you في الكومنتس حقت the previous one, Mongolian blue spots. Yes.
For the Mongolian spot, the question might not be identified this one. It might ask you what is the most common syndrome associated with this sign. They might ask you what is the most cardiac abnormality associated with this spot. That might ask you a lot of things related around the Down syndrome. So don't be happy when you get this sign. Make sure what is the question. Clear, Mohammed?
Clear, yes, clear. Yeah.
As Dr. Widad mentioned, as a sign, this one is no problem.
Okay.
The benign condition, Dr. Mohamed, it fades after 1 year, 1.5 years. No problem.
Okay. They are saying I have answer for this one.
Yes.
We have congenital hypothyroidism, cretinism,
Yes.
coarse feature, protruded tongue,
Umbilical hernia,
yes, viscous Aldrich syndrome.
protruded abdomen. Okay. Next. leg bowing. Rickets. Hello?
أيوة دكتور وداد.
أيوة. Answer.
We have bowing of the leg.
Yes. Most probably rickets.
Yes.
Maybe this is the X-ray for this boy. Cupping, fraying, wide. Dr. Mohamed?
Yes, I have cupping, fraying, widening of the mediastinum, ricket signs.
Yes. Yes. What is this sign?
The question might not be simple like that. May I ask you what is the most common, what is the most modality, common modality, or what is the modality of treatment for this condition? So please don't wait or don't expect the answer what is this always, or what is the spot diagnosis. You might ask me about the treatment or investigation of this kind. Look at the question carefully. You get it, Mohammed?
Yes, we get it, yeah, Dr. Karim. They have to read the question clearly. I have rachitic rosary here.
What is this? Describe this. What is this? What is it? It is stereotyping. What is the abnormality obvious? The rhizome where? Mohammed?
Yes, I have trisomy 21.
Exactly. What is this one? Describe it first. No, this depends. He might ask you, describe the finding. What is the type of investigation here? Might be the question, karyotyping. What is the abnormality? There is only one X. Then might ask you what is the diagnosis. Okay. What is the Yes, so please, yes, what is the question you are finish how to pass exam. You will pass exam by your because you are adult learner, you need to directly check for your learning. And you need to focus on the picture and you need to understand what is the question. We can't say anything more. Mohamed, we'll go quickly because this is normal for them. Am I right?
Yes, okay.
Mohamed.
Yes, Dr. Karim.
What is the answer there?
We have cleft palate.
Exactly.
Cleft lip, cleft palate.
Exactly. Next, what is this? What is there, Dr. Mohamed?
Still, I don't have answer. Still.
أدرس سؤال.
السؤال. The question: a 6-year-old girl with homozygous sickle cell disease presented with I don't know, this is her chest radiograph. Give 2 possible diagnoses and 3 measures designed to prevent this diagnosis. So the question here, you know, it is not described the diagnosis. It only uses a secular. So if it is me, I will ask what is the most common organism? What is the most common organism? Because the patient is secular. It's Streptococcus. Okay. What is the treatment and prevention? Good dehydration and oxygenation and ABC for this child. What is the finding? Describe the finding. Is AB or BA X-ray? So he might ask you, is this anterior posterior or posterior anterior? Usually it is posterior anterior. Anterior posterior for somebody, for a neonate or somebody who is lying down. So is this posterior anterior? Is it inspiratory or expiratory? How do you know this inspiratory or expiratory? You count the number of the rib. Is it a good or bad X-ray? Sometimes as a physician, we say, this is a bad X-ray. Well, what is a bad X-ray and what is a good X-ray? Penetration. If you can see the bone very wide, it might be over penetration. You can say bad. Or if it is not obvious, you can say also it is not clear. And also, if it is in expiratory or expiratory view, you need to look at the diaphragm. Mohamed, you are following?
Yes, we are following it. Yes, we are following. I have here collapse. I have pneumonia. I have acute chest syndrome.
All are accepted. What is this emergency? As Dr. Widad mentioned, don't say pneumothorax. Pneumothorax might be right and left. Mohamed, what is there?
Right side tension pneumothorax.
Mohamed?
Yes, I have right side tension pneumothorax.
Right side tension pneumothorax. Right. And tension should be there. I think the boys will come later, Mohamed, from your side. What do you have there, Mohamed?
They are saying dextrocardia.
Dextrocardia, right. Mohamed, what is there?
They are saying poor skin pinch, decrease skin turgor. They are saying duff skin.
He might ask you, the question he might ask you to describe this maneuver, this process, and he might ask you, what is the type of dehydration? What type of dehydration?
They are saying severe dehydration.
Yeah, he might ask you, how do you manage, what is the immediate management of this child? So the question is different. You get me? Or he might ask you, this child, what is the hospital with diarrhea and vomiting? What is the most common microorganism? The question might be like that, so you say with a virus. So please look at the question, what is it? Describe the findings here. Sorry. Ahmed.
They are saying clubbing, grade 5 clubbing, drumstick.
What else? They didn't say central cyanosis, Ahmed?
They are saying cyanosis. They are not specifying central.
Anyway, cyanosis, okay, it's central. There's cyanosis, the tongue is blue, and the lips blue, and then here we have Clubbing. The question here, my what are the possible causes? Again, describe the abnormality seen in the picture. These 4 causes of the same thing, like before. Mohamed,
Yes.
what is the answer?
Still, I don't have answers. They didn't answer yet.
So it is cyanosis like before and post-expression order.
They are saying clubbing.
Clubbing fair and causes we mentioned it before.
Okay.
What is the device? Huh? What is this? What is the answer there?
They are saying ambu-bagging.
Okay. Ahmed?
No answer yet.
Okay, it is nasal cannula. Okay.
Nasal cannula, yes. Nasal bronch.
Nasal bronch, yes. Very easy. مشكلة.
NG tube.
Okay. Okay. So don't think that the examiner always is interested to bring you difficulty. He's not a cruel.
CT scan, MRI.
What is this? It is not cough. Cough, eat it. Then I will add a question. He will tell you. He will tell you a child 2 years old. He needs this device. Now we calculate the size of it. It might be like this. Mohamed, you are clear with me?
Yes, they are following. Yes, we are following.
Not belong to the surgeon. Also, we need it sometimes. Okay, Mohamed?
Yes, urinary catheter. They are answering urinary catheter.
It is folic acid. Huh? What is the age of this child? 9 months. What is the answer there, Mohamed?
Some are saying 9 months, 10 months, 8 to 9.
8 to 9 months. Describe the finding, causes, and management. Sunken eyes, yes. Causes might be dehydration, management, you know, the ABCs and normal saline. Okay, Ahmed?
Yes, Dr. Karim.
Hello, Dr. Mohamed. Dr. Mohamed.
Yes. أيوة دكتورة وداد. دكتورة وداد, you can hear us?
Answer for last slide.
They are saying congenital hypothyroidism.
Okay.
And the question might be, what is the prophylaxis of this congenital condition? How do you prevent it? Prenatal screening.
Yes, أيوة يا دكتورة وداد.
What is the answer? Right?
Some they are saying wide space nipple. Some they are saying gynecomastia.
I think they
They will also accept it.
not.
So,
Yeah, Dr. Mohammed.
دكتورة وداد, what is the answer? صوتكم بعيد معلش.
The answer is this child has oxygen and this may show subcostal recession.
Okay, تمام.
Respiratory distress.
yeah, Mr. Ahmed.
Yes.
The clue to me,
Not clear.
I agree this slide is not clear, but I will look for the clue. There is nasal sprung, am I right?
Yes.
And then the examiner, he meant to expose the chest. Am I right?
Yes.
Then if you look here, there is chest retraction.
Okay.
But gynecomastia, it was not the ideal answer, but I agree, well, it might be. And wide space nipple also might be sound.
Okay. Some they are saying any comment about the hair? Yeah, Dr. Karim.
They comment on what?
They are asking about the hair of the child. They are saying the hair of the child is might be also a clue.
Age of the child. You are.
Hello, Dr. Mohammed.
أيوة يا دكتورة وداد.
What you have?
I have measles. I have peeling of the hand fingers. I have Kawasaki. I have scarlet fever.
Scarlet fever. Yes. Feeling maybe scarlet fever or Kawasaki. Yes.
And the question, Jama'ah, might be, what is the most common cardiac complication of this condition? Might be like that. Scribe. Red eye, if you look at the eye, red eye and a particular part. Measles. Mohamed.
أيوة يا دكتور كريم.
What's the diagnosis?
We have measles, maculopapular rash.
What are the obvious signs? They say that conjunctivitis. They observe conjunctivitis.
Yes, they are saying eye conjunctivitis. Yes.
Yeah, and then the maculopapular rash. Do not say anything about this. Repeated many times. Hello, Mohammed.
Yes. Still, we are waiting for an answers. Pitting edema. They are saying pitting edema.
It is not a good answer. They said bilateral or unilateral.
Bilateral.
Okay. Good. What is the age of this child? Our people here, they give the answer. What about your people?
They are saying 9 months. Some they are saying 10 months. I have 12 months also. They are saying mature pincer grasp. Mature pincer grasp.
It's 1 year. It's mature pincer grasp. Good. 1 year. Yeah, Mohamed, what is there? Mohamed.
I have cataract here.
Mohamed.
Yeah, أيوة يا كريم.
Mohamed.
أيوة يا كريم.
Mohamed.
Yes.
Uh-huh. How old?
I have twins. Some they are saying 12 months.
10 months. 10 months. Standing with support, 10 months.
10 months, okay.
Aha. What is this syndrome? Look at this syndrome. Look at the facial appearance. Here. Mohammed?
I have Treasure-Collins syndrome.
It's not Treasure-Collins syndrome. What else?
They are saying golden hair.
Yeah. It's golden hair syndrome. Okay, and these are the picture of golden hair syndrome. I will need say more. The autosomal dominant, hypoplasia of the fascia, and so forth. You will go and read it later. We can't say anything about this because it's repeated. This is repeated many times. Aha. Describe the X-ray finding. Lower lobe pneumonia, straightforward consolidation. I don't know, right? I don't know what about the heart. Heart is normal. Ahmed?
أيوة يا كريم.
What is that?
They are saying consolidation, lower lobe.
Lower lobe. When? Lobe is not enough. Consolidation, lower lobe is okay.
Right lower lobe.
Okay. Yes, Mohammed?
Some they are.
This is a gift now. Mohammed.
Yes.
Please, this slide and the second slide, give some comment from your specialty point of view. This slide and the second slide.
Okay, we have here, this one is a bilateral periorbital edema with puffy eyes, presentation with red urine. He need to be investigated for workup of red urine and hematuria. Might be nephritis, it might be nephritis with some protein in the urine. It can be glomerulonephritis or atypical nephrotic syndrome.
Carry on, Mohammed.
Yes, this is Coca-Cola like urine color of if the same patient. This could be, we need to work up for hematuria, and if it is present with true hematuria, we can make a workup for this one, including things like post-streptococcal glomerulonephritis, infectious nephritis, and other causes. Also, yes, it might be IgA nephropathy. It could be also in the diagnosis, but depending on the history, you will be guided accordingly. Possible diagnosis for this one, everything that can present with nephritis, like atypical nephrotic syndrome, for example. We have post-streptococcal glomerulonephritis. We have infectious related nephritis like malaria, for example, can present with this one. and other causes.
On behalf, before we thank Mr. Mohamed, on behalf of him, the mother need to be worried. Look at the question. The mother need to be worried for the child. Aha. So I will change the pattern of the question. What is the prognosis of this condition? Now we have seen this slide, and then we have seen this slide. And Mr. Mohamed, he told you the most proper diagnosis. Do the mother need to be worried? Or on the other hand, what's the prognosis of this condition? It is not atypical. He says that it might be typical, but most commonly it is glomerulonephritis, acute glomerulonephritis, most streptococcal glomerulonephritis, number one. Number two, number three becomes the other option. So we build our finding and prognosis on the common thing. So if this glomerulonephritis, most streptococcal glomerulonephritis, do the mother need to be worried? The prognosis is very, very good. Do you want to add anything, Mr. Ahmed?
Yes, actually, yes. If this is the commonest diagnosis is post-streptococcal, we need to exclude, and the prognosis is good, but in minority of cases, the prognosis might be a rapid progressive crescenteric glomerulonephritis, which can end with acute kidney injury and end-stage renal disease.
So many cases might be go to encephalopathy. Yeah, the answer is there. This is epiglottitis, but the question will be here. So what is this side? The question might be what is the most common microorganism? Hemoglobin يلا طبيعي مشكلة. If you are working with the ER and you suspect this case, you send him immediately to the ER. You will secure or should be accompanied. If you send this child to the ER, accompanied, and don't do examination routinely. Otherwise, you will collapse in front of your eyes. Mohamed, can you go ahead?
Yes, you can go. I have the same comments here. They are saying epiglottitis, Haemophilus influenzae type B, some sign, stable sign.
Yeah, the stable sign is not there. Stable sign is not there. Some sign possible, but the other sign will get it later. Okay, Dr. Ahmed, you are there?
Yes, I'm there. They are saying this is a stable sign. They are saying stable sign, yeah, Dr. Karim.
Excellent, excellent. What is the diagnosis? Group.
They are saying group.
What is the mode of inheritance? I understand. What is this one? Why? المother والfather affected. What is the answer there, Mohamed?
They are saying autosomal dominant.
Autosomal dominant. يا جماعة, go to Google image, get a lot of picture regarding the inheritance. And here, recessive هنا, dominant. Yeah, Mohamed, what do you have there?
For the previous one, I have autosomal recessive. For this one, I have X-linked. They are saying maybe this is X-linked.
خلينا نرجع من الأول. What is this?
This is
dominant.
They are dominant, yes.
And what is this? This is the recessive. This is the recessive. Yeah. Mohamed, what do you have?
I have a autosomal recessive for this one.
Autosomal recessive. Please visit Google image. And this one?
This one they answered X-linked.
Yeah. This is the X-linked. This is the X-linked. This X-linked dominant from mother, and mother can affect both. But the father is free from the beginning. So please, for more information, go and visit Google. Go to a lot of varieties. Dominant, this is recessive. So go and check it, go and study it. You are self-directed, please go and study it. يلا لا تعال حصلني عملت الحاجه جديده دكتور تعال بسرعه. You're about to finish. مين اللي بيصل هنا؟ هنا؟ لا؟ Mohamed?
Are you to Karim?
You are there?
Yes, we are there.
Okay, there is side discussion here with the doctora, and now we are going to see. Yeah, Yani, we'll come and discuss this. Let us finish the slide, then we'll discuss this here. We'll come to comment on the previous exam after a while. We'll discuss after we finish the slide. We'll discuss your comment. We need to know your reaction. So what is this? So I will ask, what is the treatment of this condition? What is the treatment of this condition? What is there any mode of inheritance? Is there any mode of inheritance? Okay. What is how you will diagnose? What are the findings in the urine? So all these might be our possibilities. Dr. Ahmed?
I have here Kaiser Fleischer ring, KF ring, autosomal recessive.
Okay.
No one answered about the treatment. I cannot see penicillamine. Yes.
Treatment, yeah. The question might be, what's the side effect of treatment? Okay. The question might be, how do you examine for this finding? Yeah, so many possibilities for the question. I think we finished by this one, and so we wait for your comment. What are your comment? And as Dr. Widad mentioned, you have the OSPE, 75% of the question will be answered. Familiar. 5% So this is a normal pattern يعني. But if you answer all the 20, that means you realize you taking all the patients, and this will not be possible يعني. Any comment, any reaction? Dr. Ahmed?
Dr. Karim. أيوة.
We finish our slide and wait for the reaction. Any reaction or any comment? Any comment from you? Okay. نمبر كم الذاكرة؟ نمبر كم؟ يا دكتور محمد. دكتور محمد. محمد.
أيوة يا دكتور كريم. أيوة yes.
They want you to comment on the reflux, grade 4 reflux, the question of MCUG.
أيوة.
They want again. أيوة. So one of the registrar here asked you to comment on it again and to say more information about it.
طيب this picture is MCUG and it shows إنه في dilated abnormal shape bladder وفيها diverticuli الأشياء اللي بنشوفها بالجنب اللي هي زي الزوايد دي. في bilateral dilated tortuous ureter وفي complete loss of اللي هو الكاليسيس. الكاليسيس usually يعني ما بتكون بالطريقة دي. نحن هسه عندنا complete distortion of الكاليسيس في both kidneys. ف this is grade 5 VOR severe form. Usually نحن we see البيكتشر دي في long standing posterior urethral valve. وممكن يكون عندنا other causes like urethral stricture, bladder outlet obstruction. And the main issue here إنه we need to do في management. If you have this picture in for example in a newborn, you have male newborn, you have to suspect LBUV. You have to do cystoscopy. According to cystoscopy, if you find a valve, you will do valve ablation. وإذا كان في bladder outlet obstruction, برضو you will do intervention for this one.
يلا نحن السيشن. في مداخلة يا حمد. السيشن بخلص هسه يا دكتور احمد زين.
ايوه يا دكتور كريم. ايوه
عليك الله رسل لي دكتور احمد هذا اللينك اللي هو يمكن يكون عنده مداخله 5 دقائق بس اللينك رايت ناو.
اوكي دكتور احمد شغال برقمه رقمه حق السعوديه حق السودان قصدك؟
رقم حق السودان.
اوكي تمام.
نحن كويسين دكتور محمد زين بيرسل لك اللينك. نحن خلصنا لكن عشان لو عندك اي تعليق عام او نصائح عامه تقول اليوم. نحن هسه شغالين. نحن السيشن ممتاز جدا وتفاعل ممتاز. اكثر من 40 قاعدين هنا و50 لكن في كميه 138 ديل في اللينك. فحسه حمد زين بيرسل لك اللينك قبل ما هم يطلعوا تديهم رساله. بس لك اللينك ناو وبعدين بعد نلاقي على الحاجات الثانيه. اي اتابع معاه هسه طوال شوف اللينك. اي تداخل ثاني اي سؤال على الامتحان ولا شافه؟ اديهم هذا دكتور محمد.
ايوه يا دكتور كريم. ايوه
هاك يتكلم مع الريسترار دي عندها سؤال مباشر.
اوكي تمام.
شغل.
دكتور كريم.
بالضبط كده. والله يا جماعه شوفوا، انتوا اخواننا الصغار طبعا، كمان ناس يكونوا اولاد، كلكم اولادنا يعني. ريالي اي تيتشر بيكون مبسوط لما يشوف اولاده ناجحين يعني. It's a policy. لكن take it from me, as Dr. Widad mentioned, if the MCQs are not similar with other, it will not be good. فلازم يكونوا similar. لازم يكون انت in a position to differentiate يعني.
Dr. Karim, are you still there? We are waiting نحن for your question.
Absent.
يلا دكتور محمد معاي؟
ايوه I can hear you. ايوه
يلا اسمع الدكتور عنده سؤال، لانه انا تعبت الليله حلقيت قفل خلاص عشان تجاوب عليها. اوكي.
الله يديك العافيه يا كابتن، ما قصرت.
عايز تخلص.
بالنسبه لنا كل الحاجات قلتها برضه حاجه الامتحان ما بيكون. يعني الامتحان حتى الحاجات اللي بنشوفها في الحوادث يعني مثلا يمكن الاوسكي ده ممكن سؤالين غريبات لكن كل الحاجات غريبه تماما. يعني الاربع سنه اللي اشتغلناها في الحوادث وقعدنا وساهرنا والعيانين اللي في الاي ما نشوف الحاجات اللي تماما. يعني احنا الامتحان جينا وسوينا الامتحان بنطلع احنا ما عارفين.
دكتور كريم، دكتور كريم، دكتورة وداد.
دكتور محمد معك سامعة؟
الصوت كان بعيد شوية يا دكتور كريم. what did she say؟
الو
ايوه ايوه
يلا الو ايوه ايوه الو
ايوه صوتك واضح كده، اتفضلي.
طيب تمام. يلا الوصف بيجينا يعني ما طيب ولا طريقه الاسئله ايوه وصف ايوه وصف. يعني انت بنطبع الاسئله المتاكدين منها في الامتحانات القديمه وجات دي بنحلها وبنكون عارفينها اذروايز نرجع البيت لسه بنراجع الحاجات. حتى الناس اللي نجحت ما في زول بيكون عارف الصح يعني ده بقول لنا بعد ذلك بنكون ننتظر النتيجه يعني ما بكون الحاجات واضحه. مثلا الامتحان ناس اشتغل لهم في واحد ناس اشتغل لهم خالص لحد ما طلعنا من الامتحان ما في زول عارف. فبس يعني ده التعليق الثاني.
ايوه ايوه. دكتور كريم، انا اي ثينك انا بخلي دكتور كريم تو انسر الموضوع ده، لانه يعني الاشياء اللي حصلت ان شاء الله في الامتحانات اللي فاتت ونيد اننا نتفاداها يعني. فبالذات القصه بتاعت انه في some people الفيديو اشتغل لهم وفي ناس الفيديو ما اشتغل لهم. انا اي ثينك انه الامور دي كلها نحن حنتكلم فيها مع ناس لجنه الامتحانات، ناس دكتور عبد المنعم، على اساس انها تكون يعني في الامتحان الجاي يعني نتفادى الاشياء زي دي اللي ممكن تحصل بالطريقه دي. ف ودكتور كريم، دكتور كريم على كونكشن مع دكتور عبد المنعم حامد من ناحيه بتاعت بريباريشن حقت الاكزام وهاو تو بوت ذا كويستشن. فديفينتلي برضه يعني حنحاول على قدر الامكان نقدر نعمل كنترول على الايشو دي يعني. بالذات حقت الاوسكي انه في ناس بيشتغل لهم فيديو وناس ما بيشتغل لهم فيديو.
دكتور محمد اجابه كويسه جدا واشكر اخلاص اشكر اختنا اخلاص ولا بنتنا اخلاص ولا حفيدتنا اخلاص.
الصوت بعيد، الصوت بعيد يا دكتور كريم، الصوت بعيد.
فنحن يا جماعه دي فرصه دائما تركيبكم برضه في تلك المسائل فيها. طبعا برضه نحن في الداتا دي قصه التكنولوجي الكهرباء الفتره دي موجوده، لكن انا بس برضه دي كلها محلوله يعني. لكن لازم نحن سبورت. يا دكتور محمد احمد الهادي الكدر دخل ولا ما دخل؟
لا لسه انا ما شايفه، انا قلت له اعمل ريز هاند لكن ما شايفه عمل ريز هاند، ما شايفه كاتب.
اي واحد ثاني يعمل. طيب هسه السلايد دي انتوا حاسين مفيده؟ الدسكشن بتاعنا ده مفيد؟ استفدتوا منه؟
بقول لك استفدنا لكن الامتحان مفيش
دكتور كريم، دكتور كريم، دكتور احمد معانا شايفه موجود الان.
دكتور احمد
دكتور احمد معانا، انا I will allow him to talk الان.
ايوه دكتور احمد الهادي الكدر
هو فيه اسئله.
دكتور احمد الكدر دكتور احمد دكتور احمد
اربع اسئله كده.
دكتور احمد دكتور احمد عاني يا دكتور احمد كلمتك بتاع الاي تي. دكتور احمد
دكتور كريم دكتور احمد الهادي موجود معاه.
بس ما سامعينه. قدموا طوالي، قدموا يا محمد الزين. introducing.
الو
اهلا دكتور احمد الهادي.
تفضل. الو السلام عليكم. السلام عليكم. كيف الحال؟ انا سامعكم.
ده دكتور احمد الهادي وجهز معانا السلايد دي، وزي ما قلنا سافر لظروف وبرضه حيكون موجود معانا ومعاكم. يلا اتفضل يا احمد اتكلم مع النواب ديل، اديهم كلام معاك.
بسم الله. اول حاجه بسم الله الرحمن الرحيم. الزملاء والزميلات معكم احمد دكتور احمد عبد الهادي. تحيه. وكان الواحد بوده ان يكون معكم لكن لبعض الظروف انا خارج السودان ومتابع معكم، ونسال الله التوفيق للجميع، والناس دائما على استعداد لتقديم كل عون ان شاء الله. برضو بشكر الزملاء المشاركين في جهد التدريب سواء كان من داخل او خارج السودان، وإن شاء الله نحن موجودين معاكم في كل الخطوات، وإن شاء الله نسأل الله أن يوفقكم جميعا، ونحن مستعدين زي ما قلت لتقديم كل العون إن شاء الله.
أما ديك ما عرفنا أصلا.
ألو.
يا أحمد واصل.
لا بس دي الرسالة اللي حبيت أوصلها لكل الزملاء والزميلات وخاصة النواب.
طيب يا دكتور أحمد، قول لهم كلمتين في إنه
طيب بالنسبة الاستعداد للامتحانات او التحضير للامتحان، اول حاجه الواحد لازم النولج. انت you have to have good knowledge. number one you have to have good knowledge. number two you have to have good training. والحاجه الثالثه بالذات الكلينيكال، الناس محتاجين ان يكون to have developed their skills بالذات في الاكزامز. يعني اذا الواحد عمل الثلاثه حاجات دي التوفيق ان شاء الله من الله، لكن دي الخطوات الواحد يقدر how to pass your exam. شكرا لكم.
شكرا لك احمد الهادي. لكن كمان انتم زودوا شويه في اجتهادكم ودائما الشرف
دكتور كريم صوتك بعيد يا دكتور كريم. We cannot hear your voice.
We conclude. We are conclude. Do you want to say anything before conclusion?
لا والله أنا I would like to thank you أنت ودكتور أحمد الكدرو ودكتورة وداد for your session today. Thank you very much. It was a very good يعني OSPE session in spite of كل difficulties في السودان. Some people they are saying إنه كان الليلة عندهم في مطرة ما قدروا يوصلوا المجلس، وفي a lot of people هنا في chat box they are thanking you برضو، وبيقول لكم شكرا جزيلا. فشكرا لكم والله يديكم العافية. This will be all for today. إن شاء الله tomorrow we will have a nephrology day. We will send for you time الschedule حق النفرولوجي والtopics إن شاء الله today. ويوم الخميس حيكون عندنا endocrinology إن شاء الله. thank you very much you are welcome.
شكرا جزيلا. شكرا دكتور محمد، والشكر موصول لكل الزملاء المشاركين في الجهد. شكرا لكم.
الله يديك العافية. شكرا جزيلا.
شكرا جزيلا. شكرا.
السلام عليكم.